Physiological changes occur in pregnancy because organism is preparing for labor and delivery. Some physiological changes during pregnancy may mimic symptoms of medical disease. That's why it is important to differentiate between normal and abnormal changes. The first trimester. Menstruation stops. Breast becomes larger and more tender, nipples may stick out. More frequent urination is normal and feeling tired is normal. Craving certain foods or lose appetite at all, sometimes nausea and vomiting. Some pregnant women gain weight during first trimester, some opposite, losing weight. Second trimester. Abdomen begins to expand. You will begin to feel the fetus move. Abdomen ache because of ligaments that support uterus are stretched. Stretch marks occurs commonly due to abdomen stretches. It can be accompanied some itchiness of abdomen. On the face, brown patches may occur called mask of pregnancy. Breast areolas more darken. Some swelling of feet and ankles may be normal, but important swelling requires medical attention. Third trimester. Pregnant feels fetus's movements strongly. Extra pressure added on bladder because of fetus resulted more frequent urination. Colostrum starts producing. Colostrum is pre-milk, and it can leak from nipples. Navel can be stick out. Now let's talk what is not normal and needs medical attention. Persistent or unusual headaches, persistent nausea and vomiting. Abdominal pain, contractions, and cramps. It can be sign beginning of labor at the end of pregnancy, but it is abnormal during other periods of pregnancy. Vaginal bleeding. During pregnancy, vaginal bleeding is not normal. Except implantation bleeding, which occurs at early stage of pregnancy. And bleeding is light and called spotting. Leakage of amniotic fluid, described as the water breaks, is not normal and its emergency condition. At the end of pregnancy, it's beginning of the labor. Decreased movement of the fetus. Any other serious health-related symptoms should be taken seriously and needs medical investigation. Laboratory. 1. Plasma volume increase. Because the expansion plasma volume, hemoglobin concentration, and red blood cell count decreases. 2. Pregnancy causes a 2 to 3-fold increase in the requirement for iron, not only for hemoglobin synthesis, but also for the fetus, and the production of certain enzymes. 3. There is a 10 to 20-fold increase in folate requirements. That's why to all pregnant, it is recommended to intake folate supplementation. 4. Vitamin B12 requirement is increased 2-fold. 5. Clotting factors concentration increase during pregnancy. That's why pregnant women has increased risk of venous thrombosis. 6. Venous stasis in the lower limbs is associated with venodilation and decreased flow, which is more marked on the left. This is due to compression of the left iliac vein by the left iliac artery and the ovarian artery. On the right, the iliac artery does not cross the vein. 7. Cardiac output increases about 40%. This is achieved predominantly via increase in stroke volume and heart rate.